My name is Hans van Vleerberg. I'm Chief of the Department of Gastroenterology and Hepatology of the Ghent University Hospital, and my major research topic is hepatology.
My name is Xavier Verhelst. I work as a hepatologist in the same department at Ghent University Hospital. I work as a hepatologist, and from a research point of view I have a huge interest in glycomics-based biomarkers.
In our department, we already have for 10 years major interest in the study of glycomics in liver disease. Glycomics is a study of glycosylation patterns of proteins in the serum. And since glycomics is done mainly by hepatocytes and B lymphocytes, it's a main interest to study these glycosylation patterns in patients with liver disease. And we could demonstrate in a paper in Nature Medicine in 2004 that the degree of glycosylation, that the pattern of glycosylation is dependent on the degree of liver fibrosis. In this way, we developed a glycofibro test, a glycosero test, and a glycoNASH test, looking to the degree of fibrosis, the presence of cirrhosis, and the degree of NASH in patients with liver disease.
For the study that was published in this issue of Gastroenterology, we moved our research to the next level, and we did not study glycomic patterns in serum, but in perfusate. As you know, perfusate is a fluid in which during a liver transplantation, liver is transported from the donor to the acceptor. And then we flushed the transporter fluids through the hepatic vein of the patients. We collected it and we studied this for glycomic patterns. First of all, we saw that it was feasible to analyze these glycomic patterns in perfusion fluids, which was new for us. Second, we saw that in patients who developed primary non-function after liver transplantation, very different glycomic patterns were seen before the transplantation. This means that just by evaluating the glycomic pattern in the perfusion fluid, we can predict which patients will develop primary non-function after liver transplantation. The assessment of the glycomic patterns in perfusate has two major advantages. First of all, we can prevent unnecessary and riskful liver transplantations if we can predict before the transplantation that the patient has a very high risk to develop primary non-function. Second, if we have a high-risk donor organ, which we doubt that it might develop PNF, using this marker, we can also evaluate that risk before the liver transplantation and thus use high-risk organs which would not be used at this moment.
The future could be that we use this test or test this test in new advances such as machine perfusion. And since this test is really easy applicable in machines using capillary electrophoresis, every routine clinical lab having this engine can perform this test.